Diabetes continues to pose a significant burden on healthcare services worldwide because of its high prevalence. Different management protocols such as diet modification, lifestyle changes, and therapeutic regimens have been developed to reduce the severity of diabetes. Attention has been focused on several bioactive agents that are capable of increasing insulin release. One such agent is amylin. Amylin, also called islet amyloid polypeptide, or diabetes-associated peptide, is produced in the pancreatic beta cells and is co-secreted with insulin after eating a meal. It occurs in the islet of Langerhans and in diabetic patients in approximately a 1:100 amylin to insulin ratio. It has long been reported that amylin is known to be associated with Alzheimer's disease and can induce apoptosis or self-destruction of the pancreatic beta cells. Amylin was discovered in humans in 1987. Pramlintide acetate, a soluble amylin analog, is marketed as Amylin, and it is used as a supplement to insulin in the treatment of type 1 diabetes. The actions of amylin and its analogs appear to be synergistic to insulin. The positive effect of Amylin in the treatment of diabetes was acknowledged by the FDA approval in March of 2005. Amylin, or Amylin, has many similar benefits as GLP-1s. These include slowing of gastric emptying, an earlier feeling of fullness or satiety, and suppresses the release of glucagon. Glucagon is a hormone that tells the liver to put glucose into the bloodstream. In one study, it was shown that co-administration of amylin analog with insulin in a cohort of adolescents with type 1 diabetes induced a larger reduction in postprandial hypoglycemia, with a reduction in the level of glucagon when compared to insulin monotherapy. Next is a short video on how to use the Amylin pen.
Hi, I'm Jen and I'm a pharmacist. Today we're going to talk about your Amylin pen. Your pen has several different parts. One is the cap, the rubber stopper, the cartridge, the dose window, the dose dial, the dose check, which you'll see later in the video, and the dose knob. You will also need alcohol swabs and pen needles to use with your Amylin pen. To use your pen for the first time, you want to remove it from the refrigerator, wash your hands with soap and water, and check to make sure that it is your Amylin pen and it is not outdated. Next, remove the cap and check to make sure the cartridge liquid inside is clear, colorless, and free of particles. If it is not, please set aside and get a new pen. Next, we need to prime our pen. This needs to be done with each new pen use. In order to do this, take your alcohol swab, wipe off the rubber stopper, take your pen needle, remove the paper top, place it straight onto the pen and twist it until it fits securely. Remove the outer cap, as you will need this later. Remove the inner cap, and this can be thrown in the garbage. Next, you want to dial up your dose to the lowest dose that's on your pen. Pull out the knob until you hear a click and it stops. Point the pen straight up into the air, and you're going to press on the knob, and you should see liquid come out. If you do not see any liquid come out, you can repeat this up to 3 times. When you do see the liquid come out, it is time to inject your medication. So again, you're going to dial up your dose, pull out the knob, and now you see the dose check window. You want to be able to see an arrow and a line. This ensures that you have selected the correct dose. For example, if you see 120 and you don't see the line, you know you've selected the wrong dose in the dose window. So for 60 milligrams, this is our correct dose that we're going to inject today. You can inject the medication into your abdomen or the tops of your thighs. Take your alcohol swab, wipe off an area of the stomach about 2 inches from the belly button. Take your pen and inject it under the skin and push in the button until you hear a click and it stops. You want to hold that in your skin for 10 seconds. Remove the pen. Take the outer cap that you set aside earlier, place it back onto the needle, and unscrew the needle from the pen. You then place this in a puncture-resistant container. Place the cap back onto the pen. You can set aside at room temperature for future doses. If you have any questions, please contact your pharmacist or provider.